What are the contraindications for the use of ANI and what are the cautions for the use? This is very important. Now, there are certain adverse effects of sacubitril valsartan which we all need to know. There's a 0.5% chance of angioedema. There's an 18% chance of hypotension. There's 3.3% chance of impaired renal function, 12% chance of hyperkalemia, and 9% incidence of cough. So the risk of hyperkalemia associated with use of MRAs was lower among those treated with ANI than those treated with enalapril and MRA. So if you have ANI and MRA on board, the chances of a patient having hyperkalemia are less than having an ANI and enalapril on board. These are also very important for you to understand. What are the contraindications and cautions when you are using ANI? Contraindications: don't use ANI within 36 hours of ACE inhibitor use. If there is a history of angioedema with ACE inhibitor or ARB, don't use ANI. ANI should not be used in pregnancy, lactation, severe hepatic impairment, that is child POC C, concomitant aliskiren use in patients with diabetes. You should not use ANI. And also, if there is hypersensitivity, which is known with ARB or ACE inhibitor in your patient, then don't use ANI. And also, what are the cautions? Try to use it when you have mild to moderate eGFRs 30 to 59. Just be careful that it doesn't slip down to less than 30%. But in these patients, just be a little cautious. Hepatic impairment, so check your liver function test. If it's mild to moderate child POC A or child POC C or B, then we should be very cautious in using ARNI. If there's a patient with renal artery stenosis, again, you should exercise caution. And systolic blood pressure less than 100, symptomatic, be very cautious. And if a patient is dehydrated, that is volume depleted, be very cautious about using ARNI. See that the patient is isovolemic when you start. What are the drug interactions? Now, ACE inhibitors is contraindicated because of the risk of serious angioedema, especially in African Americans. It doesn't appear in India, but then we have to be very careful. When you have aliskiren use, be very careful. Potassium sparing diuretics may lead to an increase in hyperkalemia, especially in patients with renal impairment, diabetes, or hypoaldosteronism. NSAIDs, concomitant use may increase the risk of renal impairment. Lithium, there's an increased risk of lithium toxicity, so just ensure that none of the other polypharma drugs on the paper are having lithium. And birth control pills, especially containing spironolactone, we should be cautious.